Hello, my name is Charles Posky. I'm a nursing student here in South Alabama. And today I'll be performing the central line dressing change assessment. To get started, I'm going to scan the room. So to get started, I'm going to verify the order, verify hospital policies. I'm then going to perform hand hygiene. I'm going to use the 2 patient identifiers, Jaguar Jones, date of birth LA 25, 1963, date of birth LA 25, 1963. I'm then going to explain the procedures for the patient, and I'm going to also assess for allergies of penicillin, and now I'm going to provide privacy for the patient. So now I'm going to observe and look at the dressing, and I'm going to palpate around the insertion line. And now, after I do that, I'm going to gather my equipment. I'm going to bring my bedside table to the bedside closest to the central line, and I'm going to have it raised above waist level. And I'm going to grab my equipment and place it onto the flat, clean surface. After that, I'm going to perform hand hygiene. I'm going to raise the bed, lower the side rails. I'm going to slightly elevate the patient's head, make sure that they're in a comfortable position. And then I'm going to perform hand hygiene. I'm going to open up my dressing and my kit. I'm going to grab from the 1-inch borders, open up the first flap to get to the mask, and then I'm going to apply the mask onto the patient's face. And then now I'm going to don my goggles and mask. On the checklist, it says that I can pull the mask down during my procedure, so I'm just going to do so. I'm going to unfog my goggles. Next, I'm going to apply clean gloves to take off the Tegaderm dressing. So how I'm going to take it off is by peeling away the Tegaderm to the center of the insertion site. And then I'm going to ball it up, and I'm going to take off my gloves. I'm going to do glove-to-glove contact, and then skin to skin. Ball that up, and then skin to skin. As doing so, I'm going to throw it away, and at that time, I'm going to assess and assess the catheter, the insertion site, and then also the surrounding skin. I'm also going to observe any signs and symptoms of any complications, and I'm also going to collect any a culture when it's obtained now. Next, I'm going to perform hand hygiene, and I'm going to open up my kit. I'm going to grab by the 1-inch borders. Now I'm going to apply my sterile gloves. Grab by the cusp. Grab from inside of the cup, pull it on, then I'm going to hold on to here. down there. I'm going to move that paper away. Next, I'm going to gather my equipment and organize it and keep away from the 1-inch borders. Now I'm going to swab it with my alcohol swab around the insertion site from the inward all the way outward in a circular motion. After doing that, I'm going to dispose it. Next, I'm going to activate my my alcohol ChloraPrep, and I'm going to hold on to the catheter here, and I'm going to clean it vigorously. And then I'm going to clean around the insertion site and the skin around it. And then I'm going to wait 30 seconds for it to dry, and then I'm going to expose that. Next, I'm going to put on my BioPatch. Like so. After that, I ran out of Tegaderm, so I'm going to use a replacement for that, and it's going to be this right here. And how I'm going to place it is going to be the center of the insertion site. And so while I'm placing it, I'm going to smooth out the edges and make sure that it is secured onto the insertion site where it will not move. Now I'm going to remove my gloves and expose to those. I'm then going to put down a label on the edge of the dressing, not on the insertion site, and I'm going to write on it the time, date, and my initials. I'm then going to perform hand hygiene. I'm going to take off my goggles and my mask. I'm also going to take off the patient's mask as well. And I'm going to lower the bed, raise the side rails, make sure the patient's comfortable. I'm also going to have the call light in reach, and then I'm going to dispose the rest of my equipment. Push that out to the side. And then I'm going to perform hand hygiene, and then I'm going to document the appearance of the site, drainage, the type of cleanser, the type of dressing that was applied. I'm also going to document the patient's tolerance to the procedure. I'm also going to document time, date, and my signature, and that will